Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are diving into Medicare New Handbook. I think we're almost there, guys. I think we might actually finish it on today's show. So, find general Medicare information online. We are at page 108. And so, let's dive in. Visit Medicare.gov. Get information at medicare.gov/plan-compare about the Medicare health and drug plans in your area, including what they cost and what services they provide. Find Medicare-participating doctors or other healthcare providers and suppliers at medicare.gov/care-compare. You can also learn about the quality of care provided by plans, nursing homes, hospitals, doctors, home health agencies, dialysis facilities, hospice centers, inpatient rehabilitation facilities, and long term care hospitals. Find out what Medicare covers, including preventive services like screening shots or vaccines and yearly wellness visits. Get Medicare appeals and information and forms. Okay. So, what I'd like to say about this is yes, you could definitely go on Medicare.gov and compare plans. But the biggest thing is that it's just all on paper, right? The ins and outs, it's not going to tell you the ins and outs of the plans, meaning the vendors that these plans use. What vendor do they use for the gym or for the over the counter or just your dental, vision, and hearing? That's really important. So let's take an example, dental. There's some Medicare Advantage plans that are dental HMO. There's some that are PPO, and there are some that are indemnity, meaning that you could get a reimbursement for whatever care with stipulations maybe, right? Or there's ones that have Visa cards or MasterCards. So the thing is, things like that, while you could get the general gist, and of course, familiarize yourself with plans, sometimes it might not be in your best interest, or there's things that you might be missing. Other things as well as is if it's an HMO plan and you have a doctor and you have tons of specialists, it doesn't show if your doctors or specialists are they in the same network, meaning are they in the same medical group? So that might cause issues. So things like that, the drugs might be also confusing. What I find is that sometimes clients do their homework, and of course, do your homework, be educated. They come to me thinking, this is the best plan. And of course, we will go with what they want. But as a trusted insurance agent, I'm going to go over like the pros and cons of each plan, the different vendors, just what's out in the market today, what's, like what are plans that have better service than others. And this is just all from experience from my clients and even our experience calling these back offices for you. So things like that, it might not be cut or dry to just go on Medicare.gov and pick a plan. That's all I'm saying. I think um, people are on group plans for so long and they have to pick their own without any guidance. So when you do get on Medicare, it is a whole new world. Yes, you could do it yourself, your DIY, you could go look on yourself, but what's another person's eyes that's been in the industry for a long time that could tell you about plans, tell you about foreseeable changes in the future that they've heard around the grapevine, or just kind of give you a landscape on what's going on Medicare today, right? I don't think it's like headlines on what's going on with Medicare and most probably don't care. Like once they're happy with their plan, it's just like out of sight, out of mind. I've been having my annuals with clients where I want to go over changes and they're fine because they want to just go on with their life, right? Unless you really need that coverage or that help. Okay. So that is my soapbox for that. So you can get your personal Medicare information online, create your own Medicare account, visit medicare.gov to log into or create your secure Medicare account. You could also add your prescriptions in pharmacies to help you better compare Medicare health and drug plans in your area. Sign up to get this Medicare New Handbook and your official original Medicare claim statements called Medicare Summary Notices electronically. Review your original Medicare claims as soon as they're processed. Print a copy of your official Medicare card. Find a list of preventive services you're eligible to get with original Medicare. Learn about Medicare premiums and pay them online if you get a bill from Medicare. Okay, that was a handful. So what I'd like to say about that is you can definitely get your Medicare New Handbook on PDF. We could help you with that. Then you get the one that gets mailed to your house. And with that one in the back, there are some of the plans on there. So definitely look into that as well. But of course, contact a licensed agent like me to go over that with you in more detail. Okay, Medicare's Connected App Directory. Connected apps are Medicare approved applications or websites that a third party, not Medicare, creates. When you connect to an app and log in with your Medicare.gov account information, you could use the app service without manually entering your health information. These third parties can only access your Medicare data if you choose to share it with them. It's always your choice if you want to connect or stay connected to a third-party app. With these apps, you can share your information with doctors, caregivers, and others. View all of the health records in one place like hospitalization, lab results, and medication. Submit your health information to participate in clinical research studies. Note, if you are enrolled in a Medicare Advantage, only Part D information is available through Medicare connected apps. For Part A and Part B data, check with your plan. Treat your personal and health information the same way you treat other confidential information. To learn more about how to use Medicare connected apps to save your Medicare claims information, visit medicare.gov/manage your health share your Medicare claims, medicare.gov/manage your health Medicare/blue/button/blue-button-20/blue-button-apps. So it's nice to get on your medicare.gov online. I believe you don't need an email address, but create the user ID and password. And it's nice to know what plan you have. Probably will deep dive on that one time too. Okay. So another thing is there is actually a Medicare New app that you could download on your phone. And this is great for people that actually um want to know what's covered, right? Sometimes it's just something off the bat that you're like, oh, like I don't want to call my agent, but what's covered, right? So it's an application, and then like you just type in whatever service it is, like chiropractor, acupuncture, and then it will say what original Medicare does cover. So in a way that's nice. So if you do have a supplemental plan, you'll know what it is exactly covered. And then when you have a Medicare Advantage plan, you know it is covered, but then you probably want to just look at your summary of benefits or contact your agent to also just make sure and understand how it works. Okay. So I think also this has to do I have my own portal website where my clients could go in and add their drugs and their doctors and so forth. So this is something that's a little bit different, but that's something you could definitely use as well. Okay. So Medicare is working to better coordinate your care. Medicare continues to look for better ways to coordinate your care and to make sure that you get the best health care possible. Here are examples of how your healthcare providers can better coordinate your care. Accountable care organizations. In an accountable care organization, ACO is a group of doctors, hospitals, and other healthcare providers who accept original Medicare and work together and coordinate your healthcare. Working as part of an ACO helps your doctor and other healthcare providers understand your health history and talk to one another about your care and your healthcare needs. This may save you time, money, and frustration by avoiding repeated tests and appointments. More coordination also helps prevent medical errors and unexpected drug interactions that may happen if one provider isn't aware of what another provider has prescribed. So that's kind of the only thing. Sometimes when you're working with a group of doctors that are not managed together, they might not know um, the prescription drugs. But I would say most doctors do ask you what prescription drugs you take, so they don't prescribe you a prescription drug that does not fit well with that other drug. Okay. Important. An ACO won't limit your choice of healthcare providers. If your doctor or other provider is part of an ACO, you still have the right to visit any doctor, hospital, other provider that takes Medicare at any time. In addition, if your primary care doctor participates in an ACO, you may be able to get more benefits. For example, in some ACOs, your provider may offer more telehealth services. This means you may be able to get some services from home using technology like your phone or computer to communicate in real time with your healthcare provider. In addition, a doctor, other, or provider who is part of an ACO may be able to send their parents for skilled nursing facility care or rehabilitation services, even if they haven't stayed in a hospital for 3 days first, which is usually a requirement in Medicare. For you to qualify for this benefit, your doctor or other provider has to decide that you need skilled nursing facility care and meet certain other eligible requirements. So keep in mind, this was implemented a few years back, and where, like, if you had original Medicare, you couldn't go straight to a skilled nursing facility care or rehab. You'd have to go to the hospital first, stay 3 days. And I've had it where clients, they're just like, oh, you have home now in 1 or 2 days, right? So please fight for your care and advocate for that, because knowing that you really can't go to a skilled nursing facility or rehab if you haven't stayed that 3 days. So just keep that in mind, because you you want to fight that sooner than later if that's the case, and you just can't go home. Um, so keep that in mind. Okay. So if your primary care doctor participates in an ACO and you have original Medicare, you'll get a written notice and or find a poster in their office about their ACO participation. There are now hundreds of ACOs across the country. Visit medicare.gov/care-compare to find a primary doctor that's part of an ACO. So accountable care organization. Okay. We are on to page 111. Sharing your healthcare information with ACOs. One of the most important benefits of an ACO is that your doctor and other providers can communicate and coordinate your care. To help with that, Medicare allows your healthcare provider's ACO to ask for certain information about your care. Having Medicare share your data in this way helps make sure all the people involved in your care have access to your health information when they need it to help you. If you don't want Medicare to share your health information with your doctors for care coordination, call 1 800 Medicare 800 633 4227 and let the representative know. Medicare may still share general or information to measure provider quality. To learn about ACOs, visit medicare.gov/manage-your-health-coordination-care/accountable-care-organizations or call 1 800 Medicare. Electronic health records. Electronic health records are a history of your Medicare conditions, healthcare and treatment with that your doctor, other healthcare provider, medical office staff, or hospital keeps on a computer. They could help lower the chances of medical errors, eliminate duplicate tests, and may improve your overall quality of care. Your doctor's electronic health records may be able to link a hospital, lab, pharmacy, or doctors or immunization information systems registries so the people who care for you could have a more complete picture of your health. Electronic prescribing. This is an electronic way for your prescriber, your doctor, or other healthcare provider who's legally allowed to write prescriptions to send your prescriptions directly to your pharmacy. Electronic prescribing can save you money and time and help you keep safe. Okay, other ways to get more information. Medicare emails. Visit medicare.gov to create your secure Medicare account. Include your email address to get important reminders and information about Medicare. Publications. Visit medicare.gov/publications to review, print, or download copies of publications on different Medicare topics. You could also call 1 800 Medicare. Go to page 124 for information about getting publications in accessible formats like large print, ebooks, or Braille at no cost. The Medicare and You Handbook is available in other languages like Spanish, Chinese, Korean, and Vietnamese. Social media. Stay up to date and connect with other people with Medicare by following us on Facebook, facebook.com/Medicare. I need to follow that. Okay, and X, formerly known as Twitter. Videos. Find videos about Medicare and other healthcare topics at youtube.com/CMSHHS.gov. Other helpful contacts. Social Security, visit ssa.gov to apply for sign up for Original Medicare and find out if you qualify for extra help with Medicare costs. Also, when you open a personal Social Security account, you could review your Social Security statement, verify your earnings, change your deposit information, request a replacement Medicare card, update your address, and more. Visit ssa.gov/my account to open your personal account. So, okay, as time goes by, there are updates to ssa.gov. So first, if you've never signed on, there's two ways to sign up, which is going to be the login.gov or the ID.me. So they made it awfully difficult for people to just sign up. So you do need an email address, a password. You'll also need, sometimes if they can't verify you, you'll need your driver's license front and back. And they also do like facial recognition for you as well. I've done this several times for clients, and they only give you 5 tries. And it's like, lo and behold, the 5th time it does work. But I did have an instance where I had 2 clients recently. One was like, you have to go to the post office to verify who you are. Okay, what a hassle, right? And then I had one was just like, we finally got in, but even when we got in, sorry, your records don't match, call us, right? So in that case, it is very, very frustrating for you. but we are here to help you walk you through it because I literally do it every single day for clients. So let us know if you need help with that. It is really cumbersome. Okay, so Benefit Coordination and Recovery Center. Contact the Benefits Coordination and Recovery Center at 855-798-2627 to report changes in your insurance information or let Medicare know you have other insurance. So this is big. Sometimes my supplemental clients, they do get bills and they are not getting paid or denied. Sometimes it's just that coordination, right? Because if you left your group plan, but for some reason the system still has it, um, it might not want to pay that bill. So just an easy call with them just to show them that, hey, you are off that group plan, you have a different Medicare policy and so forth, definitely helps. So contact us for that too, because we do help out with that as well. Okay. So, Beneficiary and Family Centered Care Quality Improvement Organization and State Survey Agency. Contact your Beneficiary and Family Centered Care Quality Improvement Organization, BFCC QI0, if you think Medicare coverage for your service is ending soon, like if your hospital stays that you may be discharged and you disagree. You may have the right to a fast appeal. If you have concerns about the quality of care you or your loved one received in a state or federally certified healthcare facility, if you aren't satisfied with your provider's response to your concern, you may file a formal complaint directly with your state survey agency or the BFCC-QI0. Call 1-800-MEDICARE to get the phone number of your BFCC QI0 or your state survey agency. 877-486-2048. For more information, visit medicare.gov/a-file-a-complaint-grievance/filing-a-about-your-quality of care. Think you guys are going to miss this. Department of Defense. So get information about TRICARE for Life, TFL, and the TRICARE Pharmacy Program. That's 800-773-0404. There's tricare.mil/TFL, tricareforyou.com. The TRICARE Pharmacy Program, tricare.mil/pharmacy or x.express-scripts.com. Department of Veterans Affairs, contact the VA if you're a veteran, have served in the U.S. military, and have questions. So yeah, like I would say for our veterans, some of it is really straightforward that you definitely should get a Medicare plan. Some aren't. TRICARE, for instance, is a little bit harder to maneuver and to understand that, but just know that we are here for you if you do have questions on that. Office of Personnel Management, get information about federal employee health benefits programs for current and retired federal employees, so federal retirees. It's at 877-767-6738 at opm.gov/healthcare-insurance/guide-me/retirees-survivors. So active federal employees, opm.gov/healthcare-insurance/guide-me/retirees-survivors. So I thought we were going to finish the Medicare New Handbook today, but we are not. We are out of time. So I am going to finish that up next week. I look forward to talking to you guys then. We are at page 113, and I think we are almost to the finish line. Thank you. You have a wonderful day, and we will talk soon. Bye-bye.